Hi, I'm Dr. Paola Annoni, and I am here with my very own patient, Scott Campione. He is about a year out from his Nuvia treatment, and we are doing something that hasn't really been done before. We're going to tackle some frequently asked questions as a doctor and patient who have gone through this journey together.
This is in 24 hours. If you forgot that, you come, you get your teeth pulled, you go back to the hotel, and then the next day, the very next day, you come and you get new teeth put in forever. I had a double bone infection, which I read on the Smile Makers Club, like, you know, I have bone damage. I don't know if I'm a candidate, this, that, and the other. It's a huge question, and I try to keep up on all that stuff, but yeah, it can be done.
So you're right. Your case was one that honestly demanded this procedure pretty urgently because you did have so much infection. And that is something that we do tend to see. You know, patients, by the time they get to us, the amount of infection that they may or may not have going on in their mouth has pushed them to be here. And the beauty of the procedure is, you know, it does physically remove all of the infection, right? So what's left behind is nice, solid bone that we can place the implants into. Now, it's good that you came in when you did, because when infection is really let out of hand for a long period of time, it does eat away at the bone. You know, I would say most people that walk through are candidates. We can figure out a way to get implants in, but of course, there's some people who just don't have bone, and it is a disability. That's not to say that, you know, there haven't been patients who have come to see us who have been told no by many people, like, right, you don't have enough, and then we're able to do it.
Yeah.
But it is more so like, hey, make sure that you at least evaluate your options, like at the kind of first sign of things going wrong, so that way you know what lies ahead. You know, do you have a ticking time bomb in your mouth? Do you have like a very urgent matter where infection can sometimes go into your sinuses? It can go spread to your brain. It can go to your heart, of course.
Brain. That's right.
So yeah,
I knew it.
It's all very important to get addressed, for sure.
So when people say on the fence, I procrastinated almost a year. I'm not gonna lie to you. So a little bit longer, it would have been no go. And then I would have...
Potentially. Yeah. I mean, you don't know what you don't know, right? And so if you don't even have baseline information, it's a guessing game. And you don't know how much time you really do have where we still are in that sweet spot of bone so that we can very predictably perform the surgery.
I know several people, some are overweight, some is genetics, a lot of it is genetics. They do want the procedure done now that they've seen it, but they have other health issues. One has sugar diabetes, one is really high blood pressure. Are they just written off? They're not able to do it? What do you do in a circumstance like that?
That is such a good question. So we see that often. You know, we have a very detailed medical clearance process, which I'm sure you're very familiar with.
Yeah.
And that's, you know, when we decide that you are a candidate via what the bone looks like. We now have to look at the whole picture because you are going to sleep under general anesthesia and you are getting a surgical procedure done. And so, yeah, we've had patients come in, you know, who are diabetic and perhaps don't have their A1C under control, or, you know, have their blood pressure out of whack, or maybe they're a smoker. There's a lot of different ways that we can work with the patient and with their providers in order to get them to a place where it's safe to perform this procedure and we can predictably perform it, knowing that it'll be, you know, knowing 99.9% sure that it'll be successful, you know, in the future as well, which is so important because, like, the last thing you want to do is invest this kind of money and time and energy into a procedure without knowing, like, hey, is this a 50-50 that it's going to work?
Right.
Like, we want to set you up for success.
And I've also learned, I have so many comments I've read, turned away by all them four specialists, this doctor, that, not Nuvia. Turned away by this company, turned away by this company. Nuvia, no problem. We'll do the procedure. Totally. You're booked.
I mean,
how do you explain that, Doc?
The beautiful thing is Nuvia has a very large network of really highly skilled surgeons in particular, obviously restorative doctors as well, but I mention surgeons because I would say almost all of our surgeons have received training in what we call complex implant placement. So whether that's utilizing the cheekbone or the pterygoid bone, which is the bone that's, behind the molars, or even just placement and strategy, they really, really do handle laying down the foundation for some very complicated cases. Ones that someone who does, 1 or 2 cases of these a month might not feel so comfortable with. Meanwhile, I would say several of our surgeons have done literally thousands, plural, of arches, placed tens of thousands of implants under their belt. And so that does come with a level of kind of, expert, if you will,
Absolutely.
that I think provides a lot of comfort for our patients, knowing that that's kind of who's in charge.
Also, Nuvia has an A+ rating with the Better Business Bureau, and we've been awarded Dental Implant Restoration's Company of the Year by Healthcare Business Review 3 years in a row.
And I feel like it's pretty standard across the board. So whether you're visiting us, in California or Salt Lake or New York or Tampa, obviously I'd love to see you in Tampa, right?
Well, my answer when I said I'm going to New York for the year, and they're like, well, we have offices. And I said, no, I'll be flying back to Tampa for my visit. Thank you.
Yeah.
But
yeah, our doctors are really, and I'm
so the
obviously know many of
irregular
them, so-
is the regular for most is regular for your team.
Yeah,
They can do.
I would
they can
say
handle pretty
something
much.
that an outfit that does like, a handful of cases a month or something like that might be pretty run of the mill for us.
They're very comfortable.
And that's not to say that it's not hard. Like
Right.
the
Of
doctors are
course, of
still, we're
course.
all like, working very hard on it. But I like to describe it once you do this many, because this is the only procedure we do, right? We don't do single
Right.
implants. We don't do crowns, veneers at Nuvia Dental Implant Center, right? Once you do so many of them, it is a very complex procedure, but to the doctors who are performing it after having done so much, it's not complicated, right? So
Right.
it becomes second
sense.
nature,
Yeah.
even though it's a very high level execution of
The muscle
skill
memory
set.
is just.
Yes, exactly.
Okay, Doc, I have a question. I don't know if this is appropriate or not, but I'm going to ask it.
Okay, let's go.
I know the Cost Guide. It's a link below. We're past that now. I've looked at Smile Makers Club. Doc, I've seen all walks of life on there, okay? I've seen garbage men. I've seen nurses. I've seen teachers. I've seen people that work in daycare. They're going out and getting loans and getting these teeth. So it's not just for the certain whatever. It's for everyone.
Yeah, I think a lot of times people hear, ballpark figures on what really, this procedure might entail. And it varies dramatically from provider to provider. I'd say at Nuvia, our pricing is incredibly competitive when you compare it to other providers for what you are actually getting, these permanent teeth in 24 hours.
Right.
I also really love that Nuvia has made it accessible to so many people. You're right. We see people from all walks of life here. The financing options that are available are certainly something that a lot of patients lean on in order to make things happen. But it's like you also have to weigh, what this treatment looks like against what the dental investment you have made and will continue to make along your life is going to look like, right? Each crown is like anywhere from $1,500 to $2,500, maybe even $3,000 if you're also
And the root
like
canal.
getting, and then plus the root canal, like that's another $1,200 to $2,000. Like it just,
And your time.
these all add up, right? Yes, the time in the chair, you're there awake while someone is drilling the entire time, and it might not seem like a substantial amount when you're just doing piecemeal, like, oh, I need one thing here and I need one thing here. Add it all up.
Right.
You know what I'm saying? And then
Yeah.
compare it when you look at it. Look, I will also say this. There's definitely patients who come in here who have all their teeth and who have some cavities. And they're like, I don't want to deal with it anymore. And it's like, we are not in the business of taking out teeth when they don't need to be taken out.
Right.
Okay.
I've heard them say, we're not going to take out a healthy tooth.
For sure.
Yeah, okay.
I like to compare that to like if a patient comes in to an orthopedic office with a broken finger and they're like, cut the arm, doc, like just take the whole thing, give me a prosthetic arm. Like, no, we're not
Right.
going to do that. So that's the same kind of thing here. But if you are deemed a candidate by the doctors who evaluate your pictures as well as your scan, as well as you as a patient, you know, that's when you really have to sit and think like, is this an upfront investment that I'm making, you know, that's designed to last a lifetime, right? Like hopefully would be lasting years and years and years into the future. How does that look in comparison to, I need patchwork, I need patchwork, I need patchwork for the next 2 decades, and then maybe we end up in the same place or indentures. So yeah, it's a personal decision and you have to find value in it as well as a patient, right? Like you have to eat and function and
Right.
smile and do all these things. If you're not in a headspace to want all these things for yourself.
Like coming in, what would a patient expect to go through such a surgery, you know, like this? I mean, you don't feel anything, I heard, right? Or do you? What's the deal with that?
So that is a question that we get quite often. You know, what is it going to be like after surgery, right? And so there's many layers to this. We have after surgery. It is a major surgery, right? You're going to have some swelling. You're going to have some bruising. We do give pain management, as you know. And I would say most of our patients really have a pretty smooth recovery. There is a very strict soft diet that we want our patients to adhere to for about 4 months after surgery. This is just going to ensure that the implants have plenty of fertile ground to integrate into, right? And so that soft diet, it's not a liquid diet. We want our patients eating real food, fish, eggs, pasta, lasagna, shepherd's pie, ground meats, all of that's totally fine. You know, but having gone through it, what did your diet look like afterwards?
My diet, I was just going to say, it's not as bad as everyone thinks it may be. It really isn't. Soft food, French toast, oatmeal, it's everything I was already eating. Yogurt, you know, soft fruit in the morning, cottage cheese and peaches.
I literally had cottage cheese and peaches this morning
There you go.
for breakfast.
There you go. I mean, is that a sacrifice? I guess so. I don't know.
Yeah.
You're healthy and you're able to get beautiful teeth. It's just amazing what you can do. And again, folks, this isn't 24 hours. If you forgot that, you come, you get your teeth pulled, you go back to the hotel, and then the next day, the very next day, you come and you get new teeth put in forever.
Scott mentioned the cost guide before, and in case you're looking for it, it is down below in the description. It really outlines a lot of other questions that patients might have, as well as all of the different financial options that are available for you if you do decide to move forward with implant treatment.